hip abduction, passive range of motion. So our zero position is, we're going to find ASIS, and there's a line connecting these two ASIS. That line should be perpendicular or at a right angle to the anterior midline of the thigh or the femur. So you can also ask the patient to help when you're taking your measurement to put your thumb right there and then point your other thumb right there. So that will help you to better visualize that line connecting both ASIS. Let's bring the hip into ABduction. So right about there, I start to feel some passive tissue resistance. What can happen with this measurement is we talk a lot about pelvic substitutions, we talk about scapular substitutions with glenohumeral range of motion measurements. Same thing applies for the pelvis when you're measuring hip range of motion. So in this case, we allow the substitution to occur, which is elevation of the ipsilateral pelvis. What we'll need to do when we take our measurement is just change the alignment of the reference arm to account for that ipsilateral pelvic elevation. So we're going to align the reference connecting those two ASIS, and then we're also going to align the indicator or the distal arm with the midline of the thigh. If you look at the goniometer here, we're going to use these red numbers since we started in this right angle or perpendicular position as we go into abduction. Hopefully you can see those red numbers. That's the scale we're going to be using. Another example is ankle dorsiflexion. When we start at that perpendicular position, then we're going to use the red dial on the goniometer for our measurement.